Well, I'm excited to be here with Tamir from Theator. Is it Theater IO? Is that
Oh, just theater.
just Theater? Okay.
Just theater.
Well, it's great to be with you. We're excited to learn more about your solution and share this with our audience here. But start with telling us a little bit about your role. So I know you're the CEO and co-founder. Tell us a little bit about when you started this, what is the driver behind the idea in your story?
Cool. So yes, I'm the CEO, which basically means I'm the mouthpiece for like a lot of very talented individuals, which we have in the team. I started theater realizing that there's significant variability in surgery and the way that it's taught and performed, and that we have a very unique opportunity to leverage technology to initiate significant like cultural paradigm shifts in the surgical world, to understand what that variability looks like, and then standardize care based on best practices that we gather and understand. The sad thing is that, today where you live determines if you live. And obviously there's a huge impact on healthcare systems, because there's significant variability within. And given the fact that the world of surgery, or the OR, is really the profit sanctuary of any given healthcare system, not having the visibility needed, not understanding what efficiencies or inefficiencies there are, not understanding like the degree of variability, leads obviously to suboptimal performance, also financially. And so ultimately, this is like in a nutshell our world.
Yeah, it's helpful. So you're focusing on the core problems within the surgical space. Tell us a couple of the core problems. You mentioned efficiency. What else are you looking to solve?
So there, as you know, we can leverage technology to enhance and improve a variety of workflows.
Yeah.
And so we started very clinically motivated, realizing that, there are other technologies out there today that optimize, patient churn and like moving them in and out of the operating room a lot more efficiently. But they're on top of that, okay, what do you do during the actual procedure, and how do you enhance performance? Not only making it safer and better and higher quality for the patient, which ultimately no one talks about, but that's like our main constituent, obviously.
Right.
But then how do we enhance, the quality of care? How do we enhance surgeon satisfaction? How do we improve workflows around education, training, like a variety of things. I'll dive into this. I have just a few slides that I'll show. But I'll give a sense of some of the issues that we're tackling. Ultimately, all of them stem from the fact that culturally, the operating room is really the last silo of lack of understanding. And as more and more procedures are done minimally invasively, which means, there's a camera, the surgeon performs the operation under visual guidance. The last mile problem is none of these procedures are routinely recorded or analyzed. And that's where we actually come in and provide value from a quality perspective, operational perspective, documentation perspective, educational perspective, et cetera, et cetera.
Very helpful. I know we're eager to see and hear more about the solution. So is it the time you want to pull up the slides and walk through some of that?
Yeah, you're the boss. All right. So really, this is something that we believe in. Data beats intuition. And I'm a physician, but I'm also a cancer survivor. And even when I had cancer, and like I was on an operating room table for 8.5 hours, and at the end of surgery, like I asked my surgeon like what he did, and it was completely different from the textbooks that he's written. And he told me, yeah, I had a gut feeling, it was this gestalt, and I'm like, no, I want data-driven care. So I think that, the world today and everything, like as consumers, we're moving towards like much more data-driven consumerism of data, of services. And I think this is obviously an area where like we can't skip this. And so this is what we believe in. And the entire being of theater, and our product, which we coined the term around surgical intelligence, really is to codify something that has been considered an art form for many years, and scale access to higher quality, lower cost care. So
like surgical intelligence.
Yep, surgical intelligence.
Okay.
So even for data-driven organizations, there's a core problem in that documentation of surgery, which is the operative report, is really inaccurate.
Mm-hmm.
Some might say an idealized version of what happens in surgery.
Mm.
And there's no ground truth. There's no visuals today, which is what we're changing. And so here's an example from a 25 system healthcare IDN that knows they have variability in their colorectal procedures or hysterectomy procedures, obviously impacting not only care, but obviously the finances, because it takes longer in some places to do procedures than others. But this IDN has no idea why this is happening or how this is happening, definitely not how to tackle it. And another part of the problem is that, there are no tools today. So a hospital may know they have more leaks than the average hospital, based on national benchmarks, but like no idea why. Or one surgeon within a system takes longer to perform a procedure compared to another, and they don't know why, unless they're in there with that surgeon on a daily basis, which is obviously something that you can't do, definitely not at scale. Or robotic procedures, more clinically and financially efficient and beneficial when we're looking at a healthcare system. So the ability to really routinely capture and analyze this type of information is extremely important to healthcare systems. So assuming that we believe that what happens in the operating room matters, AI, more than the buzzword, can actually provide the visibility at scale needed. So imagine healthcare IDN across multiple state lines. You can't be in the operating room and understand what's happening everywhere. There's a ton of variability. And so we've created the technology and the tech stack to leverage the existing hardware infrastructure that's in each and every one of these ORs, regardless of whether we're in there or not. But we just enable the routine capture and analysis of the video that's already been taken within the procedure. And there's a ton of value that we can provide based on just like routinely capturing and analyzing the video around quality improvement. We're seeing that we can identify whether or not best practices are adopted. And if they're not adopted, help improve and help increase adoption. We're able to help identify what best practices even look like. We've seen that by identifying and helping the team standardize to a best practice, we can reduce around 20% of the operative time. So that ties into operational efficiency. So, leveraging other systems, let's say your healthcare system or your ORs are able to churn and to have more patients go through an operating. Now we're the next layer on top of that are helping you not only operate on more patients, but actually provide better care, higher quality care, safer care, and reduce operative time as we're doing it. So continue to increase efficiency of surgical procedures. By routinely capturing and analyzing the platform, we're completely modifying the surgical trainee experience. For example, at Mayo Clinic, there are departments that the residents and fellows spend 2 to 3 hours on a daily basis on the platform, interacting with each other, providing and receiving feedback. So surgeon satisfaction, which is something extremely important, is also increasing by leveraging this platform. The value is derived not only from routinely capturing the procedure, but this is really the secret sauce of a lot of what we're doing. This is an example of an 8.5 hour surgical procedure, one of the most complex. It's called a Whipple procedure for pancreatic cancer. So what we do is we have an algorithmic system that can identify all of the elements that you see here on the slide automatically. The surgeon does not intervene, does not interact, does not need to do a thing. Everything is automated. And so by analyzing or doing what we call structuring of the raw video, what we're able to then do is analyze all of these components, link them to patient characteristics and outcomes in order to identify what works best in this, in whatever healthcare system, and then help standardize a variety of elements like I mentioned before. And maybe one thing that I'll just give a shout out to that we're really only in the beta stages of, but similarly to ambient documentation outside the operating room, surgeons don't like to document. And like I mentioned, it's not accurate. And so what you see here is a real world example of a minimally invasive procedure where we are already automating the creation of an operative report and documentation based solely on the video. And what this will allow us to do is obviously get surgeons to do what they enjoy most, which is, perform surgery and like reduce the documentation burden on them. But what this is also doing is making operative reporting a lot more accurate, as well as helping enhance billing integrity, and a lot of other aspects as well. But I think this was the last slide, the last slide, and like happy to jump into a conversation.
Thank you. Well, that's so interesting. Couple questions. So is this all types of surgeries that you've scaled to? Is it certain types? Where are you in that process?
So we're across hundreds of procedures,
Okay.
primarily in the key minimally invasive specialties. So it doesn't matter if it's robotic or non-robotic endoscopic surgery. We are really heavy into general surgery and colorectal and bariatric, urology, gynecology, thoracic, ophthalmology, like a lot of the bread and butter. And soon we're going to dive into like additional specialties as well. We've created like the technical deep tech backbone of what we're doing is very what's called transferable and also generalizable. So we can move very quickly between different specialties. And we can also tackle institutions that we've never seen before and like how they perform very, very quickly.
And what does the adoption within a health system look like? What is the process to get this up and running at a health system? And also curious, what is the pushback from clinicians, if any, knowing that a lot of clinicians operate by intuition, not just in the procedure room, but also outside, just how they practice clinical judgment. How are you seeing both adoption and pushback, and how are you navigating that?
Yeah, so honestly, this is only the beginning of like this revolution, I think, in surgery. And most of the healthcare systems that we are working with are really at the cutting edge of both innovation and also like their interest in, adopting like AI that works and not like as a buzzword.
That's right.
So I think there's a selection bias there that I have to admit.
Right.
So from a surgeon adoption perspective, surgeons are people. As they train, they want more objective feedback. This is the first time that they're actually receiving it and at scale. As practicing, sorry.
For training, it's great just to even see that.
For trainees, it's great. Now, once a trainee is not a trainee anymore, but is a junior surgeon attending, the status quo today is that the world is very siloed, and so everyone takes good care of you once when you're a resident or fellow, but once you're done, you're on your own, and so
you're on your own. Yeah,
we're providing for the first time the capability for these surgeons to continuously, improve the way that they're performing, and also provide some guardrails because we are, adding these capabilities, the ability to like review, analyze, at an institutional level. For the first time, we're providing visibility that is much needed in the space. Imagine like, Hospital X. You walk in, like even before you walk into the hospital, you've got cameras everywhere, like even in the parking lot.
Yeah.
Here's really like the last place where there is none, but
that's right.
The world is moving toward documenting like everything that we do as a physician. And I think like a common theme with physicians in general is that the more documentation, the better. And so here we're providing a way of doing it like a lot more accurately, a lot more transparently, a lot more objectively. So honestly, a lot less pushback than you'd think, but there is a huge cultural element to this. And what I like to, and right now we really are aiming to work only with the most innovative like teams and hospital systems, because we can bring in, like, we can sign an agreement and bring in like a great technology, but without that, but without the right culture within the institution, we won't be able to provide much
So far.
value.
Yeah,
Yeah.
that's far without that. Are there examples of specific ROI or impact that you're seeing that you can share?
Yeah, so I mentioned a few of them, but
Yeah.
you know, obviously reducing 20% operative time is something that you can
Yeah.
translate substantially.
Revenue,
Uh,
yeah.
you know, so you can do the math in your head, but like
Yeah.
how like an OR minute costs, etc.
Yes.
We are on the way to showing that we're able to reduce complications based on adoption of best practices. By the way, we're not the ones that actually define what a best practice is. That's for the surgeons and the surgical community to define. However, we're providing the tools with which they can, for the first time, actually define it, because we're providing real world data that they can analyze, etc. So those are like the key elements. Obviously, reducing readmissions, especially in a world where we're starting to move very slowly, though, to like pay for, you know, for quality of care as opposed to like the way things were, which I think is extremely important. And then just while we're just in beta around the reporting and documentation, what we're seeing is that on average, at a minimum, a hospital does not document and therefore leaves roughly $7,000 a month on the OR floor. And even for like the, you know, pay for service type of like fee structure, there are a lot of things that are not being billed. And so even here, like at a very basic level, there's substantial ROI for institutions that today are starting to adopt this. I will say though that the main form of ROI is less in like the like let's save $1 here or there, which is important, but the real ROI is, I think, in the investment in the culture of organizational, like the way that an organization performs surgery and teaches surgery, if it's an academic center, for like decades to come. That really is like, I think, the main investment here.
That's very helpful. You're shifting how this will be done in the coming years, in the coming decades. So, well,
Yep.
thank you for being with us today. I love the term Scalpel intelligence, and I think the ambient documentation from the video, I'm sure, is a great benefit to everyone who's using it. So thank you again for joining us. For those of you who want to learn more about Theator, you can come to AVIA Marketplace or reach out to Tamir and his team directly. But thanks, Tamir, for your time.
Thanks, Sonia. Thanks, AVIA, for having me.